Good morning, and actually, excuse me, good evening, everyone. I am Sable Kay. I am the Acting Director of the Office of Health Equity, Chair of our Health Equity Working Group, and providing administrative and support to our Vaccine Advisory Communications Work Group. Welcome to our COVID-19 vaccine community conversation with the disability community. To begin, we're going to go over some housekeeping pieces, and to start, we're going to review some accommodations that we've made for accessibility. So I'm going to turn things over to Veronica to discuss that, and let's wait just a few more minutes. We can allow folks to who are in the waiting room so that they can join. I'm seeing there about 20 or 30 folks who are trying to join. So let's give folks a few moments or so. And Veronica, if you could help us and explain what our accommodations for accessibility are.
Yes, Sable Kay. I'm Veronica Cosby. Our accommodations for accessibility tonight are RCC closed captionings. I just put the captioning link in the chat box. I will repeat and do so again. We have our captioner, Ms. Karen. If you see her actually in our participants list. Also, we do have ASL services. We do have Amanda and Kay on tonight for your ASL needs. And if you have any trouble or have any difficulties, please contact myself, Veronica Cosby, or Jasmine Smith by chat if you are in need of any technical support.
Thank you, Veronica. The next pieces of housekeeping is for us to get to know the over 200 folks that we have joining us today. So in lieu of a formal roll call, if you could introduce yourself via the chat box, we would love to see who we have on the call today, and are also encouraging you all that if you are not speaking, if you could turn your video off, that will make it easier for our ASL interpreters to locate individuals who they need to sign for. So if you could only have your video on when you're speaking, and then when you're not speaking to turn it off, that would be very helpful. We are going to be using our chat box a lot this evening. We are hoping that you all will be able to engage and provide questions and comments in the chat box while we are hearing from our incredible panel of folks who are going to be providing information to you all this evening. And also, when it's time, if you prefer, you could also raise your hand and be recognized so that you can orally answer your question as well. In terms of what we are going to be discussing this evening, this is going to be a community conversation in two parts. We just completed the housekeeping component, and we're getting ready to move into for our formal welcome and opening remarks from Dr. Janice Underwood, who will be introducing our governor, Ralph S. Northam, to provide opening remarks. From there, we will have a vaccine preparation overview by members of our state commissioners leadership team. We will have a review from our vaccine unit, as well as a communications overview. And at that point, we will pause and ask questions, allow you all to ask questions of our team. And then from there, we will move on to the second part of our conversation this evening. And this is when we want to hear directly from community. And to provide the foundation for that conversation, we are going to have Karen Brim, who is the Access and Functional Needs Officer, who will introduce Dr. Susan Elmore, who will provide remarks. And from there, we will move into a public comment period. We are going to allow each individual who would like to 1 minute to provide their comments. This is going to be your opportunity to share with us your excitement about the vaccine, what may make you hesitant, any reluctance, or any myths that you've heard that you would like for us to debunk. This would be that's an opportunity for us to hear from you, and then we will do wrap up and adjournment. So again, thank you all so much. Wanting to let you all know that this is an activity done in collaboration with our Vaccine Advisory Work Group, which you'll hear a little bit more about in just a few moments. Specifically wanting to thank our co-chairs, Galen Knoyton and Wendy Klein of the Communications and Messaging Subgroup. It was their work product and their efforts and the great advocates that we had on that call that brought this community conversation series to light, and working under the great leadership of our co-chairs for the Vaccine Advisory Work Group, Christy Gray and Kelly Good. This conversation is also happening in part because we have been very committed to ensuring that we are embedding equity in our COVID-19 response, and our Health Equity Working Group has been doing some incredible work over the past few weeks and months, and it's been due in large part to the effective leadership of the next person who is going to be chatting with you, Dr. Janice Underwood, our Chief Diversity, Equity, and Inclusion Officer here in the Commonwealth. So with that, I will turn things over to Dr. Underwood to provide a formal welcome. Dr. Underwood, are you there?
I am, and thank you, Sable K, for that kind introduction. My name is Janice Underwood, and I'm so pleased to be with you this evening to discuss the COVID-19 vaccine. But as Sable K mentioned, my primary charge is to promote inclusion. So I'm here this evening to turn your feedback and suggestions into concrete equity policy. We know there are a lot of questions out there. Some we have answers to and some we don't. For instance, we know that the vaccine can be over 95% effective on adults, but there is not data available for young children or pregnant mothers. So I am here simply to listen and, to the extent when I can, answer your questions. It is the top priority of the Governor's Office of Diversity, Equity, and Inclusion to better understand your equity concerns, particularly the issue of access and trust, which I know we'll be talking a lot about tonight. But like I said, the content experts that we've assembled this evening and others in the coming weeks are here to answer everyone's questions, because this information is for everyone. So if you're joining tonight as a member of the disability community, or you're an ally of the community, or you're a member of another community, this information is for everyone. And for that reason, we are trying to reach everyone. In short, it's because we care about all Virginians. And you should know there's a dedicated team who's been working a very long time in preparation for this day where we have a vaccine rolling out, to make sure that all of your questions are answered so that you have the best information to make a decision about the vaccine for you and your family. The virus, we know for sure, has exposed long-standing systemic health and social inequity, especially for those with disabilities or for those who are differently abled. With so much disparity across all communities, including those with identities that intersect between or among people with disabilities and people of color, those in economic distress, those who live in rural communities, or the LGBTQIA community, for example, we know we must build trust and ensure equitable access to the COVID-19 vaccine for everyone. And while these are very important and difficult conversations, everyone on this call tonight that you're going to meet are committed to having them with every community in Virginia, whether urban, rural, immigrant, differently abled, suburban, veteran, Asian, civilian, Latino, the interfaith community, Native and Indigenous American, Black or white, and everyone else that I may not have mentioned. So I look forward to this conversation tonight and others in the coming weeks and months. And you should know I will be listening intently, taking notes, reading the chat box, even answering. I'll be part of the team that will be answering your questions in real time. This will be a very interactive virtual conversation. But we'll be taking the information that we learned back to our team to think deeply about the issues raised tonight. I'd like to close by saying hope and 2 different vaccines are on the way, but there are several factors we need all Virginians to keep in mind. Like we must continue to wear a mask, wash our hands, and keep our distance from each other, even after taking the vaccine. We know these mitigation measures work. Also, what we know for sure is that we will have to take 2 doses of the same vaccine. This is not a live vaccine. And you should know there is no out-of-pocket cost to any of our residents, including for undocumented immigrants. So in the meantime, stay home if and when you can, and we really must support each other with facts. Please only get your information from trusted public health sources like the CDC, your own care providers, our own Virginia Department of Health, the governor's office, or even the Virginia Department of Emergency Management. The only reason I bring this up is because there are already a lot of vaccine scams going on. So please be on guard, because there are folks out there that will attempt to use this moment for their nefarious personal gain. Thank you all for the sacrifices you've made to get us to this moment. I'm bumping elbows with you all. Together we will get through this, like we've done time and time again when we have faced a crisis together as Virginians. Now I have the distinct honor to introduce our next speaker, my friend. Governor Northam is someone who is walking the talk, and we are so fortunate that during a time of a public health crisis, he brings to this work his experiences as a former Army doctor, a pediatric neurologist, a business owner, a state senator, and former lieutenant governor. But what's so important for you to know is that Governor Ralph Northam, the 73rd governor of Virginia, has a heart for all people, especially those who have been historically marginalized and underrepresented. And it is this love for all Virginians, and I mean all Virginians in particular, that guides every decision he makes, because I've seen it for myself. Please welcome the 73rd governor, Governor Ralph Northam.
Well, good evening and happy holidays to all of you. I hope that all of you are and your families are staying safe and healthy. And I just wanted to give thanks to a number of people. This has been a tremendous team effort for the last 10 months, but starting with the young lady that just introduced me, Dr. Janice Underwood, our first in this country cabinet level position for equity, diversion, and inclusion. And Janice has been with us for well over a year now. Time marches on, but she's just done remarkable work. And I want to thank her and for just making sure as part of the Health Equity Commission that we're serving all Virginians. And so Janice, thank you for that. I also wanted to recognize, and I don't believe he's on the call tonight, but our Secretary of Health, Dan Carey, Dr. Dan Carey, who's a cardiologist, and nobody would have ever predicted we would be in the situation we're in this year, but he and his team have literally worked every day around the clock to make sure that Virginians are safe and healthy. So thanks to his folks. I know we have some folks here from the Virginia Department of Health tonight, led by Dr. Norm Oliver. And again, they have just worked so hard, and we're blessed in Virginia to have so many folks that come to work every day and do what's in the best interest of Virginians. So for those of you that are on the staff of Virginia Department of Health, I say thank you. I see my friend Gayleen Knoyton. I don't know if Dr. Wendy Klein is on tonight, but certainly they have been just totally influential in helping keep Virginians safe. They're part of the Virginia Vaccine Advisory Group. And so to Gayleen and Wendy and any other folks that are on that committee, I say thank you. But most importantly tonight, as Dr. Underwood said, we want to thank you, those of you that have taken time out of your busy schedules to be part of this Zoom call. And we're all kind of getting used to these Zoom calls tonight. It's kind of interesting. I certainly would rather be with you in person, but we are in the middle of this pandemic. But it's very, very important to us, as Janice said, that we get you accurate and updated information that is factual. That's important. But perhaps more importantly, we want to hear from you, because if we listen and learn from you, then we can turn what we learn into action. And that's certainly what we want to do as we move forward. So thanks to all of you for being with us tonight. I want to just make a couple of brief comments. There are some very exciting things going on in Virginia and this country right now. And there are also some very concerning things. And I want to address the concerning things first. We are still right in the thick of this pandemic today. We had over 3,600 new cases in Virginia. Our positivity rate, which is something that we follow closely, is over 12%. It was less than 5% just a month and a half or so ago. We have more people in the hospital. We have more people in the ICU, more people on the ventilator. And unfortunately, we are having more deaths. And that's very, very bothersome to all of us. Today, we recorded 38 additional deaths in Virginia. So while there's excitement, which I'll talk about in just a second, we need to be vigilant. Just as Dr. Underwood said, we need to continue to really follow the measures that we know help to mitigate the numbers. And that is to wear our facial protection, to keep our hands clean and away from our face as best you can, and also to keep our social distancing. And as was said, if you don't need to be out, and I know this is a tremendous sacrifice, but just stay home. And that's your safest harbor right now until we get this pandemic behind us. And there's certainly light at the end of the tunnel. We want to get our children back in school safely and responsibly. We want to get our businesses back up and running, but we've really got to get this health crisis under control and, as I like to say, in our rearview mirror. Now for the exciting part of it is the vaccination arrived in Virginia on Monday, just as was promised and planned. And by the way, we collectively, some of the people that I thanked just a while ago, have been working on distributing this vaccination for several months. We want to do it equitably. And I was at a hospital on Monday when the vaccinations arrived. I was at another hospital yesterday in Hampton Roads, and then at one here in Richmond today to witness individuals that were first in line to get the vaccination. And it's a time where we've been in a long, dark tunnel for 10 months. And this vaccination is the hope and the light at the end of that tunnel. And so we want to make sure that everybody in Virginia is comfortable and really do our best to answer your question. There are obviously some logistical challenges that we have moving forward. This vaccination, as you know, it's one from Pfizer and one hopefully will be approved as early as Friday from Moderna, have to be stored. Individuals have to receive 2 vaccinations. So the Pfizer is follow up with 21 days, the Moderna is 28 days. And then there's the trust issue, and Janice spoke to that. We really want to make sure that all Virginians feel comfortable that this is a safe and effective vaccination. And I will tell you, I'll take my governor's hat off and I'll put my doctor's hat on. I have followed the data as these vaccinations have been studied, and the FDA has done it by the book. Over 30,000 individuals have been tested. And so I am very comfortable and confident that the vaccination is safe. And while Pam and I both had COVID, and we're thankful that we had mild cases, but it is nothing to play with. And I just wanted to let you know that as soon as my time is appropriate to get the vaccination, Pam and I plan to receive the vaccination and again, do everything that we can to put this pandemic behind us. So this vaccination, you'll learn about it a lot tonight, will be rolled out in phases. And And my message to all of you is continue to be vigilant and also be patient and be kind to each other. We need more kindness in the world right now. We need to take care of each other. We need to make sure that our families are safe and healthy, but also reach out to our loved ones, our neighbors. We're all in this together. We all want to be part of the solution to put this behind us. So thank you for the opportunity to be your governor, number one. But thank you for being with us tonight. And I just, in closing, want to wish all of you all a happy, a safe, and peaceful holiday season. And I look forward to being in person with you as soon as possible. So thank you so much and have a good evening. Thank you, Sable.
Thank you, Governor Northam, and just really for your thought leadership, for your commitment to equity and diversity and inclusion. You are truly serving as a role model for each of us individually as Virginians, but also for providing leadership for other governors from across the country. So thank you for taking the time to directly engage and discuss with us. Just wanted to press pause for a moment. I know that we've had some challenges with some of our accommodations, so I just wanted to take a few moments to address some of those issues in the chat that I've seen in the chat. First of all, I would love for, it's been brought to our attention that for those of you all who aren't speaking, if you could please turn off your video. It makes it easier for the ASL interpreters to be seen, and also makes it easier for folks for everyone to be able to access those accommodations. I also wanted to chat about what's going on with our closed captioning, and I'm going to bring in Veronica Cosby to discuss what's happening there. Veronica?
Yes, Sable K. I'm sorry, I was on the phone with RCC. At this time, we are not seeing the captions within the RCC link. So captioner Karen, just to advise, can you please either follow up with your RCC person or myself through the chat, because we are not seeing RCC captioning on the link that has been provided. And so Sable K, we are working on this now.
Thank you, Veronica, and our apologies. It looks like Karen Brim has put, so it looks like people, and perhaps the issue's been resolved. Karen Brim and some others are saying that they are seeing the captioner via the link. So it looks like this technical issue might be resolved. If other people are able to see, please let us know in the chat. Again, we want to make sure that everyone can have the opportunity to participate, ask questions, and be able to follow the conversation and actively engage. So thank you so much for that. And it looks like we are getting some good feedback there about the RCC link now working. So with that, we are going to turn things over to our healthcare experts. On the line with us today, we have Jeff Stover, who's Executive Advisor to the State Health Commissioner here at the Virginia Department of Health. Jeff is a part of the DREAM team that will be helping us to ask questions. So wanted to provide a few moments for Jeff to introduce himself, talk about his role and how he's supporting our vaccine efforts.
Sure. Thank you, Sable K. Appreciate you having me here this evening, and thanks to everyone for joining us. It is a pleasure. It's unfortunate that we're gathering at a time of a pandemic and for reasons to try and get that under control, but we are doing everything we can here at VDH to ensure the health and safety of all the citizens of Virginia. In my role here in the Commissioner's Office, I'm assisting with multiple projects that in large part are associated with the COVID-19 response as it stands today. I've been helping to lead the exposure notifications app activities. So we're over 900,000 people who've downloaded that today in Virginia. And that has been truly a leadership moment for the Commonwealth of Virginia. We're really proud of everyone who's been helping to do that. And we're going to try to work that into how we can assist with vaccine prevention as well. Anywhere that we can help to push out information that deals with vaccine prevention and whatever mechanisms we can, we want to be here to help do that. So I know we have Christy Gray here with us this evening, and just to level set for a moment, it is incredibly important that we're having these kind of meetings with folks at different times. Diversity, equity, and inclusion are at the core, I think, of what government should be doing today. And I think Virginia is leading the way where that's concerned. We're really proud of that. And it's important, I think, for us to step back and think about what COVID is actually meaning to us, and why it's so incredibly important. And Dr. Underwood and Governor Northam both alluded to this, but, we have seen at this point over 292,000 cases of COVID-19. And, to put that in perspective, the most cases we have ever seen of a reportable infectious disease in Virginia prior to COVID is an STD called chlamydia, and that would maybe be 40 couple thousand cases a year. And that far exceeds any other infectious diseases. So, that just provides us some context. The governor mentioned over 3,600 cases in a single day. We're seeing like 55-fold increases compared to like back in May. And we recently, just in the last couple of days, we've reached over 4,500 deaths in Virginia, specifically from COVID. So there couldn't be a better time for us to get the vaccine here and to start to get that dispersed out to the communities in need. I think Christy's going to talk more about those specific priority levels as we go through 1A, 1B, and 2, and who the individual priority groups that are going to be getting it, such as our healthcare providers and long-term care facilities. We're looking to do this quickly. We're going to need everyone to help us. I think we'll be looking at 480 or so thousand doses of this vaccine that should be delivered to Virginia just in the month of December. So it's going to be a monumental effort. We're up for the task. It's not going to be easy. It's going to take longer than we'd like. But I think, we will persevere. And with the help of everyone, including all the citizens of Virginia, everyone doing their part and doing their part to really be a beacon in their community and be someone who stands up for, the truth. I think Dr. Underwood and the governor both alluded to the fact that this is incredibly important. Trust in what we're doing is incredibly important. Public health is no stranger to mistrust. Where things like the Tuskegee study, et cetera, occurred in government. So we know it all too well, and we understand that trust in government and trust in what we're doing on your behalf is of the utmost importance. And that's what we're going to be here to do. And we're going to provide all the answers that we can. So without further ado, again, thank you for having me here. I'll be here to try and answer some questions in the chat, but I'm going to turn this over to Christy Gray, who is the Division Director for the Division of Immunizations within our Office of Epidemiology here at the Virginia Department of Health. Christy.
Hello, good afternoon, everybody, or good evening. Thank you so much for having us today. We were able to do one of these last week, and it's such an enjoyable experience, not only to be able to exchange information and I provide updates, but get information back and understand how, if we have any gaps in our planning and how we can improve that. And so we really appreciate all the questions and concerns that you share with us today. And we want to make sure that we are taking them into account and updating as needed. So I just wanted to do a brief overview of our vaccine planning. One of the main points is the vaccine, not only is it coming, it's here. We've received 72,000 doses in Virginia between Monday and Tuesday of this week. We are expecting about 480,000 doses by the end of December. And as we are using those doses to vaccinate the priority groups that have been identified by the CDC's Advisory Committee on Immunization Practice, those are healthcare personnel and nursing home residents. We're going to use those doses to vaccinate those persons as priority. As has mentioned before, this entire vaccine rollout, it will take time. And so it is important that we are continuing our mitigation strategies of washing our hands and covering our, wearing our masks and keeping our distance from one another. We are, excuse me. So another point that is very common is the vaccine, and Governor Northam mentioned, touched on this, the vaccine is safe and effective. We are only distributing vaccine that has gone through the process, has been reviewed independently by the FDA independent committees and the CDC independent committees, and have been proven by that data to show that they are safe and effective at preventing the spread of COVID-19. And we have been working on this process, and in separate from COVID in general, response to pandemics is something that is not new to the agency. We practice emergency response plans every year. We update them. In this case, we modified our emergency response plan to account for COVID-19 considerations, such as needing to ensure social distancing in mass vaccination clinics. That's not something we've had to do before in flu clinics. So this is not new to us as an agency, and we've had plans that we have built on. And I've also heard concern that the vaccine has come in so quick through this process, and surely there must have been steps that have been skipped in this process. In reality, it's just that in a traditional vaccination approval process, the vaccine is not really goes from step to step in the approval process until the manufacturer has come up with the funding to move it to the next phase, because it is their financial risk that is at stake if the vaccine is not found to be safe and effective. In this scenario, the US government has purchased these vaccines and has paid for the cost to manufacture them. So there is no time needed to raise funding or provide funding to go from step to step. And should the vaccine be found to be not safe and effective, the vaccine is just destroyed. So although the financial piece has been removed, the financial barriers have been removed, the steps in which the review of the safety and efficacy data have not been skipped and have not been cut in any way. So we can feel confident that the data that has been shown has gone through the same exact approval process that any other vaccine has gone through the US government, through the US to the US market. I also like to mention, when I talk about safety and efficacy of vaccines, is vaccines, as opposed to a medication to treat, is given to healthy people. And therefore, it has to have a stronger benefit to risk ratio. There has to be much more benefit to risk for a vaccine than other treatments that might be coming through FDA review. And that's because you're preventing it, you're not treating it. And so these are just some general background about the vaccine approval process. I always found to be very helpful in understanding how the vaccine comes to the market and how the process and what is involved in ensuring that it's as safe and effective to the public. Lastly, I want to touch on that we will be distributing this vaccine fairly and equitably throughout the Commonwealth. We have been preparing for doing this since June. We stood up our vaccine unit of the statewide unified command in June and have been preparing since then, with our ultimate goal is to vaccinate as many people as possible, as quickly as possible, to reach that herd immunity in order to control the pandemic and hopefully return to the normalcy we all desire. However, because the supplies are going to be limited at first, this vaccine has been being manufactured for months. However, it still takes time to manufacture vaccine. So we have limited doses and they have to be distributed across the entire US. So Virginia has its allotment that has been given to it based off of our portion of our population versus the entire US population. And we need to ensure that that is going to those that need it first, to ensure that they are protected, because they are at most at risk at either acquiring infection, or if infected, to have the most severity of infection. So as at first, the vaccines will be limited, but the vaccine supply will increase, not only because the vaccines that are being manufactured will continue to be manufactured, but we will have other vaccines that might be possibly introduced as other options. So for example, Pfizer was introduced first. Moderna is being heard before the FDA independent committee tomorrow. And if it is approved to be given, then we will then have more vaccine to be able to distribute out, because we have another vaccine and its manufactured doses to distribute. Overall, we are looking at likely 3 to 4 phases of vaccine distribution, with the first phase being this limited to the healthcare personnel and long-term care facility residents. The next portion of population that we're looking at are called essential personnel, or your critical workforce that allows everything to keep running while that we want to have running, that if they all were to get sick, then the post office, the grocery stores, the electricity, there's a list of essential personnel that we have in our planning, and that is typically used for response plans. And with that, we're also, we get interest from people that contact us or the governor's office about their interest, and we bring that in, and we're working at the Department of Health to identify these people and to work through how to identify them, how the groups of people, how many of them exist, and what priority order might they exist. An aspect of that is, I mentioned the CDC Advisory Committee on Immunization Practices before. That same committee is meeting in 2 days to have that same discussion and to consider who would likely be that next group of people that we should ensure are vaccinated next. It is also expected that the group after that would be medically vulnerable, and as well as those, and that could include some comorbidities, people who have multiple chronic illness, or those with weakened immune systems. And after that, we would look into more the general population then, and as those phases are increasing, we would expect the manufacturing to increase and the number of doses available to us to also increase. So that is really where we're going between now and probably maybe May or June. I don't have a crystal ball to know for certain, but that's our current planning. And there's a few other things that I just want to touch on. Dr. Underwood mentioned this a little bit earlier. After the FDA approves the vaccine, FDA and the advisory committee on immunization practices determines who should recommends who should get that vaccine. So we really rely on those committees to indicate whether pregnant women or women who are breastfeeding should be getting vaccinated. In the case for Pfizer, they did not, it was not considered what's called a precaution or a contraindication, which would give you pause necessarily to vaccinate. And this weekend we would expect them to recommend similar on the Moderna vaccine. And all these recommendations are done based off of the data that are provided from the trials. And so we, based off of that, essentially for Pfizer, pregnant women can choose to get vaccinated with the Pfizer vaccine. There's nothing saying that they shouldn't. However, there is still no data to necessarily support that it is safe. And that is actually very common, that when vaccines are initially released, that there is no data for pregnancy, for vaccinating a pregnant woman. And we'll see what they say about the Moderna vaccine. Similarly, children were not in the initial trial data for either Pfizer or Moderna. However, I know earlier this month, Moderna announced that it is starting to enroll children aged 12 to 17 into their clinical trials. So we will see how that data shows. And so if that is found to be safe and effective, then the advisory committee could recommend vaccine down to age 12 for Moderna vaccine. All of these recommendations are likely going to remain vaccine specific for some time. I did want to touch a little bit on the fact that these are both Moderna and Pfizer vaccines are what's called mRNA vaccines. And sometimes that is a new technology for vaccines. And so I just wanted to explain a little bit about how that works. So mRNA is a small nucleic acid, and it essentially teaches your body to develop a protein which teaches your body to recognize if you are exposed to COVID-19. And it's really training your body to, without having to be infected with COVID, how to respond to it. And it's a very neat, kind of nerding out here, a very interesting approach to, because really all vaccines do this. They teach your body on how to identify COVID. I'm sorry, they all teach your body how to identify an infectious agent. But this is a new way to do that, and it allows your body, a vaccine to be created very quickly, as opposed to maybe traditional vaccines that take time. You have to grow them. For example, a flu vaccine typically is grown in eggs, and it takes a long time to grow the virus. So this allows us to really respond very nimbly in this example. It does not, these vaccines do not give you the virus. It is just teaching your body on how to spot it if you are infected in the future. And Dr. Underwood also mentioned costs. There's no out-of-pocket costs to somebody to get this vaccine. Your insurance company can be charged the administration fee, but neither the insurance or the provider can come back to the person and say, give me the administration fee or give me this vaccine. Everybody will have access to this, whether you have insurance or whether you are documented in Virginia. And I did also want to mention about tracking. So we are putting all doses administered into our Virginia Immunization Information System. That is our state immunization registry. It is a database that consolidates immunization data from multiple sources into one record that a provider can use to make better healthcare decisions with you for treatment. Whether you've been vaccinated against something can impact the type of treatment your provider might recommend for you, whether that's being vaccinated again or vaccinated at a specific point in time to ensure that there's enough interval between your vaccines, or if there's a medication that they're thinking of prescribing for you that might be impacted if you've been vaccinated recently. So it is a very helpful tool for healthcare providers in Virginia. It is, you have to register with VDH in order to get access to it, and you'll need access. And you have to show you need it for your job. So you are really only healthcare providers access this information. And it's important that people are in this information so that if you maybe get your vaccine in Southwest Virginia, and then now you're in Northern Virginia, but you're due for your second dose, the provider in Northern Virginia can see, oh, you got Pfizer last time, let me make sure I give you Pfizer this time, because these vaccines are not interchangeable. We do not share this information with any other entity, including the CDC. We will be providing a redacted file, which says there is a record of a vaccine, but it does not have first name, last name, or any other contact information or PHI about the person that would identify the person. So I'll go ahead and stop there. I'm happy to answer any questions you have, and thank you again so much for having me.
Thank you, Christine. So I know that there are several questions that have come up in our chat. We've been doing our best to answer as many of them as we can, but I want to, I know that there's some folks who have their hands raised, and there also are some questions in the RCC chat. So before I start going into our thematically grouped questions, I want to provide an opportunity for us to hear from folks. So I'm seeing 2 hands raised. If Alex Sprague is there, Alex, are you there?
Yes. Yeah.
Great, wonderful.
Well, I actually had a more general question of, so I'm with the Alexandria Commission for Disabilities. And one thing I've been talking to this commission about is maybe the possibility of providing, or if we can invest in certain therapists or therapy groups in which once we get back into this, once we're able to get back into the swing of in-person things, without having to fear infections, some people might not have an easy time adjusting to that. And I was wondering if someone could address the possibility of maybe allowing these kinds of things so that certain folks with certain intellectual disabilities or folks with autism would have an easier time adjusting or readjusting to the public. Is that possible for us to do?
Is there anyone on our panel who could address Alex's question?
This is Dr. Elmore Sable.
Mm-hmm.
Okay, I will give it a general answer. Okay, depending on the situation, and depending on how things are funded, yes, you possibly could get some interactions through either the waiver program or through DMAS that we can do. But this is a question where we can also take back to all the groups that we're on, and then that way we can discuss it a little bit more as to what we think is needed. So that's one reason for the listening session. So we're glad you brought it up, and I've made a note on it, and we will continue to discuss it. But yes, if you have a case manager, support coordinator, any of those linkages to a community services board, that would be a good place to start. And then we can also pick it up on our end.
Thank you. It definitely needs to be discussed more. So thank you so much.
Thank you. We will.
Thank you, Alex, and thank you, Dr. Elmore. We are getting several requests in the chat for us to address specific questions. Specifically as it relates to the disability community, folks are just trying to bring them thematically, grouping some of the pieces that we've heard. People are concerned about the issue of consent in terms of how folks with developmental disabilities, intellectual disabilities, how folks are going to, what is going to be the informed consent process for those who are living in these congregate care settings. And also there have been questions about whether or not folks will be able, like, how do we incorporate or engage those who may have a disability of some sort? How do we prioritize them in the population?
This is Christy Sable. So for the long-term care facilities, the CDC has set up what's called the CDC Pharmacy Partnership for Long-Term Care Facilities, where they contracted with Walgreens and CVS to go on site to facilities and vaccinate the staff and the residents. And part of that process is sending ahead consent and related information to be completed before they get there. So that's how the long-term care facilities that are enrolled in that program will work. That's primarily the skilled nursing facilities in Virginia, and most of the assisted living facilities in Virginia. That is how they will get vaccinated. Our local health departments and some other pharmacies or perhaps Walgreens and CVS, we are in discussions for state contracts with pharmacies as well to provide similar service to those long-term care facilities that are not enrolled in that program, and to ensure that the information is provided to the residents and to avoid any kind of coercion or making sure there is informed consent.
Sable, this is Dr. Elmore again.
Mm-hmm.
If I may, let me tag on a little bit to Christy there. And for everybody on in the audience tonight, keep in mind that this is an evolving thing. So we hear new things every day. And one of the things I heard in one of the calls today with the Department of Behavioral Health and VDH that's come through CDC is CDC is working on the consent. Then it will be sent to VDH, and the Virginia Department of Health will then look at that consent. DBHDS, the Department of Behavioral Health and Developmental Services, will then take that consent and we will try to put it in plain language or put it in visuals or whatever we need for our developmental disabilities population. We have a team on the Department of Behavioral Health side that's going to work on the communication part of that. So right now, we don't have it in our hands. So that's why the community services boards don't have it yet, because it hasn't come to the state. The CDC has to put that out and then it will come to us. So as soon as as we have it, we get it, we will distribute it. So yes, and there was another question there about the group homes and residential. They have been included in the CDC and the CVS and the Walgreens contracts is what we understood in the meetings that we have been in to allow sponsored residential, the group homes to go to CVS or them to come to the facility. So that's coming down the pipe. If you're living on your own, then yes, the CVS is going to be picking part of that up too. So there's still more to come. So hang on a little bit. Back to you, Sable.
Thank you, Dr. Elmore. I just wanted to be cognizant of time. I know that there are a lot of questions, and I want to make sure that we also have an opportunity to have some questions that have been raised in the RCC chat to get that answered. So I know that we have a few folks with hands up. So let's go to Winter next. Winter, are you there? And if we could try to make our answers as concise as possible so we can try to get through as many questions as we can. But Winter, are you there?
Yes, I'm here. I want to kind of represent the highly allergic population of the disabled community who are also high risk for COVID. And my questions kind of revolve around what are the recommendations for those individuals with a history of anaphylaxing to vaccines in the past? And will they be having a way to observe those individuals either admitted in the hospital or immediately treated for anaphylaxis in the case that they react to the vaccine? And is there going to be a way of tracking people with disabilities across the board who start to get this vaccine, and as we see how they interact with their medications and with their underlying conditions? And will that data be used to help inform other people with disabilities as they make informed decisions about if it's safe for them and their bodies?
And this is Christy. Thanks so much, Winter, for the question. Yeah, there are some clinical considerations for those that have had severe allergic reactions to vaccines in the past. The recommendations from the Advisory Committee on Immunization Practices, there is a precaution for those that have had that experience, and it is a contraindication for those that are allergic to the specific vaccine ingredients, and those can be found on our, they can be provided and they can be found online. Happy to send out that information. For those that have just had reactions in the past, not necessarily specific allergic to the ingredients of the vaccine, it is recommended that those persons are observed for 30 minutes after vaccination. And all of our local health departments, as well as it is recommended for any provider that is vaccinating, are trained to provide that response quickly, including having response with like an EpiPen also, and be trained on how to do that on site. And that might also influence where a clinic might be set up for vaccination, to ensure that allowance is built in. For example, including EMTs on site for is a plan that our local health departments are working in place. For any vaccination, whether you have been, for anybody else, it's recommended that observation of after vaccination is of 15 minutes. And that is really typically any vaccine, but just to ensure that there isn't any reaction that is unexpected, unlike the one where you have had the experience in the past and you watch for 30 minutes. The second question was about tracking people. So there is a system that has been put in place specifically for COVID vaccine to watch and to have special observance over those that are getting COVID vaccine due to just the nature of that there's we want to be conservative with these new vaccines and watching them, and also provide that added assurance to the public. So they have set up this system called VSafe, VSAFE. It's on a link from our COVID-19 vaccine website, but it's also available on CDC. And when you receive your first vaccine, providers are asked to give you the information to enroll into the program. And that program really just, it includes information about you, and it checks in with you often to see how you're doing, how are you feeling, and if there's any sort of symptoms that you're experiencing that would be considered not normal of your just everyday life. That information is brought back and incorporated into what's called the Vaccine Adverse Event Reporting System. That's VAERS. And that is a system that is in place for reporting of any adverse event for any vaccine by any person. And that ensures that that vaccine reaction is getting reported out. So not only do you know the person who is experiencing that adverse event and can provide guidance to that person, but we can ensure the information is getting supplied into the larger data set that is nationwide, which allows the CDC to identify signals when there might be something happening. And that just kind of stems into the vaccine safety piece of this, that once a vaccine hits the market, that is not when review of the data of safety and efficacy stops. Vaccines are watched continuously after the market to ensure that there are, as it's administered to more people, even though the trials include thousands of people, once it gets into the market, it opens up the opportunity to be vaccinated to millions of people, in which you might see those once in a million situations that are happening. And those systems that are in place, I've mentioned two now, there are actually 3 others that watch for this. And again, that is because of the nature that vaccines are given to prevent and not treat, and therefore it has the most rigorous review process in the world, and to ensure that our vaccines are the safest that they've ever been. Did I answer your question, Winter?
I think so, Christy. And I just want to take a moment to address, there are a lot of folks who are raising concerns. So I just want to hold space for some of the concerns that I'm hearing in the chat, and just wanting to make sure that the folks who are on our panel are aware of some of the things that are happening there. I just want to verbally speak on some of the pieces that are here. Folks are wanting to further disaggregate the disability community. So those with specific accommodations, needs, and concerns would be able to better follow the information. It's been difficult for folks to read through the chat and then also to listen. I do want to let everyone know that the recording of this presentation, along with the recordings from all of the other community conversations that we've had, are going to be shared with the individuals who have registered. We are collecting with each of these conversations the questions that are being asked, and we are feeding those directly to, we have communications, VDH, Virginia Department of Health communications staff on the line, who are going to be incorporating the questions that are asked here into our frequently asked question document that currently lives on our VDH COVID-19 vaccine webpage. So I know that everyone's trying to take note and to capture all of the questions here, but we are going to do our best to make sure that your questions are answered to the extent that we can answer them. And we are going to be sharing, when we send out the link, we are going to be sending out the link with the recording, excuse me. We are also going to be sending out the questions for the link to the Q&A portion, the answer to the frequently asked question document. So I will be sure to make sure that you all receive that. And this document is a living, breathing, growing document. It has been informed, and we're holding 6 of these community conversations so far. And we want to, and the FAQ document has been updated with each of the iterations based on the information that we've received. So I just want to press pause here. I'm seeing that we have one additional hand raised here. Beth, you're recognized. Beth, are you there? I'm seeing Beth's iPad. We'll just give a couple more moments.
Sable, she's saying that she's not able to unmute herself. Is that something that's being controlled by a host, perhaps?
Let me try to unmute on my end. Are you there, Beth?
Oh, there I am now. Thank you. I don't know what you did, but that worked great. I'll turn my picture off. Yeah, I had one question. I have a daughter with an intellectual disability that has multiple medical issues that would fall into that first, what, 1C criteria about a high-risk medical individual. How would we go about getting her upgraded? Do we need a doctor's note? I'm not sure how to go about to do that to help her. She lives at home with me, so she's not going to fall in the congregate category of individuals. I think that we'll get it vaccinated first. And I know several of my friends have the same question.
This is Christy. Thanks so much, Beth, for the question. I think you're asking how you can get your daughter moved from 1C to higher.
Yeah, well, she has, I mean, she lives at home with me, so she's not going to be in the category of individuals that live in congregate living, which I completely agree need to be vaccinated before individuals that don't. But she has so many medical issues that getting the virus would not be a good thing. So she does fall in that top category that you had the picture of that said individuals, adults, because she is 25 years old, that have multiple medical issues. How are you going to judge that? I mean, what do we need to do to show you guys that she does have these issues?
Thanks, Beth. And I know that it is very frustrating when I say I don't necessarily have that information yet. Right. As Dr. Elmore mentioned, the information that we're getting is very quick and it's changing. We do anticipate hearing more from the advisory committee on immunization practices this weekend that will help inform our next steps.
Okay.
And in general, people will be vaccinated according to the plan of the local health district. So there's 35 health districts in Virginia, and each health district has different resources and needs and populations. You know, something that a Northern Virginia district would be very different than Southwest, different than Southeast. So each district has its own populations it's considering and working with its resources such as the hospitals and health systems that are in their district to identify how they will vaccinate the residents in their district.
When you say,
for example,
when you say health districts, is that like our public health department? Like well, I live in Chesterfield County, so I would contact them to try and see.
Sure.
Okay.
Yes. So you would contact Chesterfield Health Department. I say district. There's several departments in a district,
Right.
but that's fine. Yes. Chesterfield
Okay, so
Health
that would be
Department.
an idea of where to start about what we might need documentation wise to help some of our folks that have medical issues.
Yes, and I will say right now we don't have that information, but we are working on it as quickly as we can. And so
Okay.
just want to let you know that they don't have it yet, but that is where you will go and everybody should go when they have questions about what's going on in their community.
Well, I appreciate all you're doing. I know this is a lot, but thank you.
No!
That would be her yelling no. So good night.
Not a problem.
Hey, Christy, I just wanted to follow up to what Beth's question and the comment that was had there, just to go back to some of the pieces that have been raised in the chat. People are asking a lot of questions on how, like, if I know you just mentioned that folks should reach out to their local health districts, but people are asking a lot of questions as it relates to timelines and when we will be progressing through these phases and what care the Virginia Department of Health is taking to ensure that the needs of individuals with disability are included. So if you could speak to how about this iterative process, how we are working collaboratively and how we're really looking to center those needs, because I'm just sensing and seeing a lot of concern and a bit of frustration in the chat because people are like, why are we, I've seen a couple of times, why are we vaccinating folks in long-term care facilities and medical professionals if there's all of this information that we don't know?
Sure, Sable. What we do know is that healthcare personnel and people that live in elderly that live in long-term care facilities are at most high risk of infection and are at most high risk of severity infection if they are infected, which is why the Advisory Committee on Immunization Practices recommended they get prioritized first for vaccination, and VDH adopted those recommendations, and that is why we're implementing them first. We want to, I want to emphasize that I hear you, I hear that you are frustrated, and I completely understand where it's coming from. And it is not our intention to cause that. We've been working for several months to think through several different scenarios and how to approach priority groups. And one of the factors that we use is those recommendations. They are based on the data, on where we can make the most impact as quickly as possible. We will continue to incorporate the needs of all different groups, including those that you represent tonight. We have several members serving on our vaccine advisory work group that we meet with and discuss different barriers and solutions that we can do to address them. And we are incorporating that guidance and information back to our local health departments who are implementing those at the local level and are very keen to ensuring that those populations are not left behind, that they're brought in and they are incorporated into those plans. I do welcome anybody who is not already on our vaccine advisory work group to join, to ensure that that continues and that voices are heard. But I do want to make sure you know that we have incorporated those and we are aware of them, and we are working to ensure that they are brought into our planning.
Thank you for that, Christy. And I also wanted to lift up a comment that I see in the chat that that I think also is speaking to a lot of what we're sensing and hearing here today, that the unease that is also with the historic mistrust of the disability community, and knowing that that is a factor, folks wanting to make sure that they are still protected and not seen they're not treated as disposable. So thank you so much for raising that, and for other folks who are echoing those concerns as well. So with that, I just wanted to I see Sherilyn Spencenberg. You will be our last oral question before we address some of the pieces that are in the RCC chat. Sherilyn, are you there?
Yes, I am. Can you hear me?
You're recognized. Sure
Okay.
can.
I just had a question. I just really wanted to find out the studies. Have there been extensive studies done on people with sickle cell and MS that also have, various allergies as well?
Sorry, I was on. Dr. Gray, it's my understanding that that individuals with certain conditions were included in the vaccine trials, and we are just in a process where we are all learning and growing together. This is one of those situations where living through the scientific process isn't as fun, I suppose, as when, to the extent that we learned it in school, that it was there. So what we're trying to do in the conversations here is to share with you the information that we do know,
Okay.
and then to the that there are items that we don't know, be clear and transparent and honest with you about that, but also let you know that we are here, the Virginia Department of Health is here as a trusted resource for you, and that
Okay.
as soon as we get answer to those questions, there are mechanisms through the website that I was showing you earlier that I'm going to put on the screen again, is that
Okay.
this is meant to be the beginning of a two-way conversation. And we are hoping that in opening this conversation with you all, we are going to be collecting your information and also collecting your questions, but also wanting you all to be aware of the resources and information that we have, including items like our vaccination website. That's going to be your best bet
Okay.
for accessing the most up-to-date information. We want to make sure that as soon as we're informed, that you're informed, and that vaccine, COVID-19 vaccine website will have the most up-to-date information about as we learn about these specific subgroups and populations and specific medical conditions as we learn more.
Okay. Thank you.
My pleasure.
Sable, this is
And
Christine.
go
I
ahead,
just wanted,
Christine.
to let everybody know that anyone can come to the Vaccine Advisory Work Group meeting. The login information is posted on Town Hall. Could you send that out to the attendees so they're aware of how to attend that?
We can certainly do that. Absolutely.
Thank you.
So with that, I do want to hold some space for some individuals. We've gotten a lot of really good feedback and questions asked during this section, but I also want to make sure to the extent that we can answer some of the questions that are in the RCC chat as well. I know Dr. Gray, you've been, Dr. Elmore, you've been monitoring some of those pieces. Are there any questions that are in the RCC chat that haven't been addressed yet?
Hi, Sable. There is one over here. The question is, it's uncertain to know how the vaccine is going to be distributed. And is there a list of clinics, dates, places when the healthcare providers will get it, i.e. the patient first, the free clinics? And I know there was some discussion of there is a free clinic website where people can go to identify a free clinic near them. And we have a URL for that. But I don't know that we've gotten to the point where the free clinics know what their schedules are yet. But would you address that, please?
Absolutely. Christy, are you there?
Yes. When there's more vaccine available, we were able to provide out where people can receive it, where the general public would be able to receive it. Right now, we are doing primarily what's called closed pods, closed points of dispensing, in which the population is targeted to not necessarily open door for anybody to come. But once more vaccine is available, we would have those locations. We can make them available to the public on our website.
Thank you. And I just want to, I know that we have about 10 more minutes remaining. Really wanted to extend the time because I think that the feedback that we were having through the Q&A was very helpful and enlightening. But I do want to provide an opportunity for, we have two disability advocates speak, and would love to have Karen Brim, our Access and Functional Needs Officer for the Virginia Emergency Support Team, to address you all and to introduce our next speaker before we give directions for how we will be handling public comment for this community conversation. Karen, are you there?
I am, Sable. Am I coming through?
You are.
Great, thanks. Hello, everyone. I'm Karen Brim. I'm the Community Services Program Manager for the Virginia Department for the Deaf and Hard of Hearing, but I'm also serving as the Access and Functional Needs Officer to the Virginia Emergency Support Team at the Virginia Department for Emergency Management, or VDEM. That's just a big, long way of saying that I support VDEM and the Unified Command during an ongoing disaster with planning and response efforts as they relate to people who have access and functional needs. And that umbrella includes people with physical, sensory, mental, and developmental disabilities. For the COVID-19 state of emergency response, that has meant contributing to efforts such as health equity, accessible communications, testing, tracing, and of course now vaccination. Since the start of the pandemic, AFN Outreach has also included nearly 50 partners calls with representatives from various state, regional, local organizations, including governmental and non-governmental organizations, in order to identify and provide a channel for communicating needs, concerns, and trends back to the Unified Command. Members of VDEM's Access and Functional Needs Advisory Committee have contributed greatly to that effort. And one of those founding members of that committee is Dr. Susan Elmore, who you've already heard a little bit from tonight. Dr. Elmore is a healthcare management professional who has dedicated over 40 years, 26 of those in state service with VDH and the Department of Behavioral Health and Developmental Services. And she's devoted those years to her passion of helping persons with various complex disabilities connect with the healthcare system, assistive technology, and advocating for the person through person-centered practice. She advocates for the person to be seen as a person and not as a disability. Due to multiple work-related concussions and surgical errors, she has been a person living with the physical and residual concussive effects. Her depth of knowledge and her lived experience have allowed her to assist many families, guardians, physicians, and other professionals to navigate the healthcare system and understand related complexities. She's also contributed greatly to the access and functional needs efforts here in the Commonwealth. Dr. Elmore, I want to turn it over to you for a few words, and thank you so much.
Thank you, Karen. Thank you for the introduction, and thank you to the governor, Dr. Underwood, Sable Kay, and all the distinguished professionals for coming tonight and bringing this together. You know, according to the 2019 American Community Survey, there are over 1,120,000 civilian, non-institutionalized persons in Virginia with disabilities. And you know, it seems like we have a million questions to go with each one of those people. And we know it. We know they're different and unique situations, okay? Along with being differently able, there go other issues such as things to transportation, communication, access to buildings, medical care. The list goes on and on and on. These two affect our decision-making when it comes to a vaccine and the pandemic. And so many of you on this call live with those effects day to day. And we want to do our part to stay as independent and as able as possible. So part of this we want to talk about, and you heard Karen mention access and functional needs. We have had professionals, we've had people with disabilities on the calls, and we've been working in various different ways trying to address issues for our disability community or our differently able community. There's still things we don't know, okay? As you heard, the vaccine, we don't know. We don't know how it's going to react in a person with autism. Those studies were not done. What we can tell you is we realize that we all are a vulnerable population. We all want to stay on our best plateau that we can to maintain life. We want our caregivers to be able to take care of us if we need caregivers to take care of us, and that they stay well, and that as the mother that was talking earlier, that her child stays well, or her adult child. So what we can tell you is we've heard from the historic experiments where persons and institutions were used as non-voluntary research subjects for medical treatment. We know the Tuskegee experiment story. So thankfully, society has learned from those lessons. And today, as you've heard on TV, there are clinical trials going on there with volunteers. So the downside to that is, because we are not using people with disabilities, as test subjects like we used to do, there's not a whole lot of data coming out from the volunteer world on what the vaccine will do. So this is why you will hear us say, we're all still learning. COVID is new, vaccine is new. What we do know and what we have answered so far is that you will not get COVID from the vaccine, which is one of the questions a lot of people had asked. The consents, yes, they're work in progress. Soon as we get something, we will work on it. Many of us have been working 7 days a week to try to get information out or learn what we can learn to present and help you, particularly our public health partners at VDH. So there's more scientific evidence to come. My words to you as a person with a disability is to read the facts. Read the facts on the CDC website, the VDH website, and they can put in the chat the link to the VDH vaccine page. And there are multiple questions that have been answered on that page that will give you a lot of good baseline information. We want you to ask your questions of VDH. They're the professionals who know, they're the experienced epidemiologists who know. We're working with them to provide them answers, to educate them on the difference of when we work together. We're talking about group homes, we're talking about sponsored residential, we're talking about autism and DD and all of our disability populations. But like I said, there are a million questions to go with the million of us with disabilities just in Virginia. We still in Virginia, we might be disabled, but we're still able. We're able to read, process, ask questions until you feel comfortable to take the vaccine. The choice is yours, but what we want to do is make sure that, yes, you're informed, so your questions come to us and we will work on them. I have lived during the polio days, and I remember lining up to take the polio vaccine. Back then, we didn't have a whole lot of choice. You were told you would go line up and take the vaccine. This is similar in the fact that we will have a vaccine. You will be able to make your choice. If the ones wanted up front can get it up front, and then there'll be more later on coming. Okay, this is similar, but we need to do our part to end the invisible disease of COVID. And that includes what you've already heard and what you know. Mask up, physically distance, wash your hands, wash down your area, and so that now we can get vaccinated and get control of this. So read the facts, check the website, the questions will be on them. They've added many more questions just in the last week from other listening sessions. So we want to be sure that you do as we did in the 60s and get vaccinated and beat COVID. We will take your questions, and Karen and I in particular, along with Sable and everybody else on here, will take your questions to heart and try to get you answers when we can, or watch for the information when it comes out. Is it safe for a person with autism? I'm not the person to give you that answer because we don't know. There's not been a study that we know of to date for the vaccine being administered to a person with autism. So I would say with that, consult your physician and ask your physician what his or her opinion is for your medical condition. The same for those of us who have multi-complex issues or have polypharmacy issues. Right now, consult your physician. As soon as we know, though, we will let you know. The information, as soon as we can get it, it'll also come to DBHDS. We have a team at DBHDS that is working to get information to providers. And you have to keep in mind, this only got approved and out this weekend for Monday. So as soon as things come out, then we'll work on them and get them out to the providers. So that's where we are today. It does change every day, and we will be sure to give you the best we can, but give us good questions on what you need. Be sure when you ask your question that you're clear on your situation or concern, so we have the entire picture visible to us, so that we can give you the best answer. I'll use the example of the mother that spoke earlier. It said her adult child was at home with her. That's what we need to know to give us the visible picture of what the conditions are and where the person is, and then we can give you a more concrete answer. So with that, I'll keep it short and sweet and turn it back over to Sable.
Thank you, Dr. Elmore. And I just want to provide some guidance in terms of how we are going to proceed with the public comment. We recorded, or we saved allotted 90 minutes for our conversation here today, but just given the nature of the questions and just the sheer amount of questions that we had, thought it was most prudent for us to spend the majority of our time today answering your questions and really holding space to try to answer as many of those questions that we can. Wanting to let you all know that this is the first in what is going to be a series of conversations, a series of opportunities for us to learn from you and with you and to share the information that we have, and that this is going to be the beginning of the conversation. We are, like I mentioned before, this event has been recorded. It will be shared with all the individuals who have registered for tonight's event. We are going to be sharing with everyone the chat transcript, the RCC transcript. All of that information will be shared with those individuals so that everybody will be able to have access to that information. We are also going to be sharing, there's been a lot of really great networking that's been happening in the chat, so we are going to be sharing the contact information of both the individuals who are serving as panelists who have shared their information publicly, and also for those of you all who want to be a shared resource for us. So, we want to make sure that we have these open lines of communication, and this is really just the beginning. We wanted to share with you what we do know, to let you know that with the information that we have, Virginia is doing its best to move forward and develop a plan and implement a plan that's going to be respectful of the lived experiences of individuals across the Commonwealth, regardless of any of their circumstances, including that there's ability and regardless of their ability and their varying access and functional needs concerns. So we want to make sure that we are as accessible as possible. So just wanting to let you all know that this is still going to be an opportunity for us to hear from you. We are at the end of our time for today, but we will certainly set up another one of these conversations, perhaps more compressed, so that we can have specific reach outs to specific groups within the disability community to address some of those concerns, but we will take that back to our access and functional needs partners and to our partners in the Vaccine Advisory Work Group to make sure that we are creating an environment where we can learn from and with each other. So with that being said, I want to thank everyone I just want to thank everyone for their participation this evening. Would like to encourage everyone, if there were additional comments that you would like to make, in addition to the questions that have been raised in the chat box, you can feel free to email us at ohe@vdh.virginia.gov. These instructions will be repeated in the email that will be going out to you, but we do want to make sure that you all have the opportunity to share your additional questions, comments, and concerns. With that being said, I'm going to open things back up to our panel to see if there are any closing remarks that any of you all would like to make. Anyone from our panel?
Say, well, just one and kind of a closing remark, but to make a point of awareness here from one of the questions, and that is keep in mind that when we say nursing facilities, we have people of all ages in the nursing facilities. We have some that are children that are under the age for which the vaccine is recommended. So just kind of keep that in mind, that when we talk, we're talking broad because we have so many different types of situations on this call. So please read the fact sheet, please read the VDH website. There's a lot of great information that'll help everybody. And then, yes, send us your questions and we'll be glad to answer them. Thanks, Sable, for all you did to moderate this, and I'll sign off for now.
Thank you, Dr. Elmore.
And Sable,
Any
this is,
other?
hey, Sable, this is Jeff. I'll just make the comment. I think, I've been trying my best to keep up with what's going on in the chat. It's been moving very quickly. But I did reiterate at one point that, we'll certainly take questions that have come in through this. We've not been able to get to all of them. I know some are very specific. We may not have answers to, but I think we can use the feedback that's coming in from this to improve what we're doing, improve how we're getting things out to folks, and create some, facts and questions kind of documentation that we can get out on our website to help inform everyone throughout the Commonwealth. So I'm appreciative of, the comments that have been made, and we will do our best to get answers to all of them.
Thank you, Sable K, for your leadership. Thank you for your team. And we appreciate you bringing these conversations to the community. On behalf of the governor's office, thank you to all who joined us tonight. We are reading the chat. We will get back with you and answer all of your questions. Thank you so much.
Thank you, Dr. Underwood. Thank you, Jeff. Thank you, Christy Gray. Thank you to Karen Brim, the individuals who had, and also the biggest thank you is to each and every one of you who participated on our call this evening. We are truly here to be thought partners with you all, to learn from and with you. So thank you for your questions. Thank you for your comments. And we look forward to engaging and continuing this conversation long after our chat this evening. And we will be in touch very soon. I hope that you all have a good rest of your evening. Thank you.